Hello, I'm Lucy Chappell. I'm Chief Scientific Advisor at the Department for Health and Social Care, and I'm a consultant obstetrician at Guy's and St Thomas's.
Great, lovely to meet you, Lucy, thank you. I'm Katie Heil, I'm 28 weeks pregnant, and I have plenty of questions to ask you, if that's okay.
That would be wonderful.
So just a bit about my situation. As I said, I'm 28 weeks. I had already had my second jab in July, but I didn't know that I was pregnant at the time. And then I had COVID before Christmas, but I haven't had my booster yet. And so for me, I'm wondering, how long do the antibodies last? And when should I get the vaccine? Should I get the vaccine? And what are the benefits to me of getting the vaccine?
So your stories are quite typical. It's really good that you chose to get your 2 vaccines last summer when they were offered and that you took those up. And it's also really relevant that you were considering pregnancy maybe, but you still went ahead and got your vaccine. And in fact, we know from lots of data that the vaccine does not impact on your fertility, clearly not, and that was a very good way to protect yourself as you went into pregnancy. How did you find getting COVID in December? Were you okay, and were you and the baby all right?
I was. I didn't know I had COVID at the time, and I took a PCR test and it came up positive. And I had a sort of mild, almost like tonsillitis symptoms, bit of a sore throat and just feeling really tired and not particularly great for 5 or 6 days. But I was worried.
Yes.
And I called my midwife and asked her about, and this is another question for you, I guess, like what are the implications for women who are pregnant? And I was in my second trimester at the time, but particularly as you get later down the line into pregnancy, what kind of impact can that have for pregnant women?
So I'm glad to hear that you weren't seriously unwell with it and that it was managed at home, and that certainly is the experience for many pregnant women. But we're worried because we are seeing numbers of pregnant women being hospitalised with COVID complications. So the complications that we're worried about are women needing respiratory support, so that might mean needing oxygen or needing to go to the intensive care unit. 1 in 6 women who are hospitalised with COVID-19 need to go to the intensive care unit. But also, particularly for women in their 3rd trimester, the last 3 months, we sometimes need to plan birth in order to get the mum better so that the baby can be safe. So 1 in 5 need preterm birth and 1 in 5 of their babies need to go to the neonatal unit. So we're seeing, in particularly recent months, more sick women and sick babies than we did in the first 2 waves. And also of concern, 96% of the women that we see who are hospitalised with COVID are not vaccinated. We know that pregnant women have had to make some really difficult choices through the pandemic about, it really encouraged them to attend for maternity care. And now we're really clear that we're recommending the vaccine because of all the work that we've done around the safety of the vaccine in pregnancy.
And on that point about safety, one of the things I felt when I found out I was pregnant was, I've had a vaccine, is my baby okay?
Yeah.
And, and I was a bit apprehensive about that, and I was given lots of reassurances, but how do we know that the vaccine is safe for babies?
So in recent weeks and months, we've been putting out data that have helped us to look at that safety in pregnancy specifically. So in a really good piece of work by the UK Health Security Agency, they looked at the outcomes of pregnant women who had received the vaccine, and they compared them to the outcomes of women who had not received the vaccine. Now, we have to remember that in the early months of 2021, we were offering the vaccine to either health and social care workers or women with additional medical conditions. So they're not quite typical groups. But even with all those, the reasons why we might see differences, there were no differences, no safety concerns. So we looked at stillbirth, at low birth weight and preterm birth, and no difference between the groups. So we matched that up with data from the States where they've been giving the vaccine to pregnant women, hundreds of thousands of women, and we also match it up with data from our regulator, the MHRA. So pregnant women are reporting in side effects and adverse effects to the MHRA, and we used all those 3 data sources to tell us how were we seeing any signals of concern, either in the UK or from other countries, US, Europe, Israel, that would make us worry. Absolutely no concerns, which is why when you look at the complications that COVID-19 causes for pregnant women, when you weigh that up, just like pregnant women weigh up lots of these choices, that's why we're recommending the COVID-19 vaccine for pregnant women.
Okay, and because I've had flu and whooping cough, those are vaccines that women are quite kind of familiar with, and I felt I sort of felt that's something that you just do. You just have those vaccines because they're suggesting they've long been established and as having them. But is the COVID vaccine sort of part and parcel of sort of normal vaccination now for pregnant women?
So you make a really good point. We've been using flu and whooping cough vaccines in pregnancy for some years now. And that came about for the flu vaccine. We were concerned about pregnant women getting ill with flu. So we've been recommending it every flu season to protect pregnant women. And if you protect a woman, you protect the baby. For whooping cough, it came about by a slightly different way, which is that we were seeing whooping cough cases in newborns between 0 and 8 weeks. So in that period before babies got their protection directly from the whooping cough vaccine. So we started a campaign in the UK to offer the whooping cough vaccine to pregnant women so that they would make antibodies, they would safely pass across the placenta so that the newborn was protected in the first 8 weeks. And that's been a really successful campaign. And we know that hundreds of thousands of pregnant women take up flu and whooping cough vaccine every year. So now we think it's the same with COVID-19 vaccine. This is a way to protect yourself as a pregnant woman and also to think about how you're protecting your baby because of all the complications that can happen with COVID-19 in pregnancy.
That's really helpful. Do you think because I've had COVID and because I've got antibodies, or might have some antibodies, although I don't know how many, that I still need to have it? And is there any benefit in waiting until, for example, my 3rd trimester so that I maximise the benefit to myself and the baby? Is there any advice around that?
We know from work in adults who aren't pregnant that having infection and the vaccine gives you extra protection. It's a particularly good way to protect against all the complications of COVID-19. And there's every reason to think that the same is true in pregnancy. So we recommend a 28-day gap, and we're particularly keen that pregnant women are vaccinated have adequate protection from the vaccine by the time they go into their 3rd trimester at 26 to 28 weeks. So what we say though in pregnancy is the right time is now. So for any woman considering vaccination in pregnancy, whether they're in their 1st trimester, their 2nd trimester or their 3rd trimester, if you're called and if you're eligible for either a first dose of vaccine, some women haven't felt ready yet to come forward there for their 1st dose, or their 2nd dose, or their booster, it's good to go and get the vaccine. And we've done lots of things to try and make that accessible. So some of the simple things, we heard from pregnant women that they didn't want to be standing in queues. So we've now arranged that pregnant women can go to the front of the queue. We know that's important to women with children, so we wanted to make it possible. We also wanted to look at how can pregnant women get the vaccine at the same time as one of their maternity appointments. And that probably matters to you to try and make it convenient.
It does, because you're trying to you have so many appointments, you're trying to sort of maximise, the benefits when you go to an appointment and get several things done at the same time. I haven't, I booked and then I got COVID. Yep. So booking again now, because I wasn't aware that it was easier for pregnant women to get the vaccine now. Is there any advice on how I do that? Should I speak to my GP or should I?
So we would like pregnant women to feel that they walk into their vaccination centre prepared and ready, and that we've got midwives, obstetricians, GPs. There's someone for every pregnant woman to access. We're making the the information available in a range of languages if you look at the NHS England website for people. And we've also got a very wide range of vaccination clinic slots available. For pregnant women, they will all be offered Pfizer or Moderna. In fact, the huge majority of the population are anyway, but sometimes pregnant women ask me, what will I get? So it will be Pfizer or Moderna, and both of them are safe in pregnancy. And pregnant women typically find the slot that works for them, whether it's, we've got a vaccination centre in our hospital. So when I do antenatal clinic, I say to a pregnant woman, you can walk downstairs and turn left and go straight into the tent. But other pregnant women may choose something near their home or a walk-in or whatever suits them.
I know for myself, I've been quite worried at times going into hospitals
Yep.
and having multiple appointments, and I
Yeah.
felt quite exposed sometimes, especially because I haven't had my booster. What would you say about that and
Yeah.
what you recommend for pregnant women?
We really want to encourage pregnant women to attend for their maternity care visits so that we can provide the best maternity care for them to keep them and their babies safe. So in fact, that's another reason to think about vaccination, because that is your best way to be protected against getting COVID-19. And so it means that you can attend your maternity care and birth safely.
And what about after birth? And for example, will I have antibodies in the breast milk, for example?
Yep. So after birth, we know that pregnant women who have antibodies pass their antibodies in the breast milk to the baby. We've always seen this as a real positive. It's a way to give a newborn baby additional protection. So, for example, that's why we give the whooping cough vaccine in pregnancy, so that the woman passes antibodies during the pregnancy to protect the newborn baby.
Thank you. That's been so helpful. You've really helped me answer lots of questions that I had, so really appreciate it.
Thank you, Katie, and thank you for being so open about your journey and what it's like to be a pregnant woman at this time.